Long-term follow-ups for Raindrop patients. Eye care professionals who recommend the Raindrop Near Vision Inlay as a treatment for presbyopia should also have a plan of providing long-term follow-up care for their patients. Implanting an inlay into the cornea is safe and effective, so to maintain the longevity of good outcomes and corneal health, biannual examinations after the first year post-op are recommended. Why is it important to follow Raindrop patients on a long-term basis? First, you must understand that implanting a corneal inlay is quite different than undergoing a LASIK procedure. Although the Raindrop Inlay is composed of a transparent, biocompatible hydrogel material that allows excellent nutrient flow, it is an implant in the cornea and should be monitored for any inflammatory response. It is recommended that Raindrop patients be checked every 6 months. Identifying and eliminating or controlling inflammatory risk factors such as smoking, allergies, and surrounding unclean environment is beneficial. Lastly, don't forget about the dominant eye and the normal refractive and health changes that may occur over time. The eye care professionals should be on the lookout for changes since the last visit. Here are some important questions to ask. Has the patient experienced any change in health or medication? Has the patient undergone any surgery? Has there been a change in environment at work or home? How often does the patient use artificial tears? Are they preservative-free? We are looking for triggers that could lead to an inflammatory cascade, which may lead to corneal haze. After a purposeful case history, look for clinical changes. The key word is changes. Compare the distance and near vision with the previous visit. Is the near vision still functional? Is the patient experiencing difficulty while driving at night? Has the best near vision moved closer? Again, don't forget about the dominant eye. Changes in the uncorrected visual acuity and refractive changes in the dominant eye can affect the overall vision and comfort level. Look for refractive changes in the Raindrop eye. Is there a myopic shift? This could be a sign of corneal haze or inflammation. Is there a hyperopic shift? This could be due to unstable cornea. Compare current topographies, wavefronts, and the slit lamp appearance of the inlay. Take photos so accurate comparisons can be made. Again, the key is to watch for changes from the previous visit. Lastly, build trust with the patient so they remain compliant with using preservative-free artificial tears and keeping their follow-up appointments every 6 months. Explain the results of tests performed on both the Raindrop and dominant eyes, and review indication for drops or treatment. Be sure to schedule a new appointment every 6 months before the patient leaves the clinic. And finally, educate the patient to call immediately if any prolonged change in vision, foreign body sensation, or ocular discomfort is experienced. Identifying and treating complications in its early stage will result in the best long-term outcome.